The next session, session number 3, is chronic diseases, biomarkers, and biomarkers. And before we start this session one more time, I would like to ask all speakers that they have to be very disciplined and giving our time. And because it was almost 1 hour behind, so we had only half hour lunch, and now we can So, anyways, so first our presenter is Dr. Alessandro Di Cerbo, and his presentation is from Modena, Italy, and presentation topic is functional food and nutrition from pets to humans.
Thank you very much. So I will talk about new perspectives in clinical studies from pets to humans. So let's start with the definition. What is functional? Function is a food which provides benefits beyond the provision of essential nutrients and is consumed on a regular basis. The role of functional foods in human studies started with around almost 10 years ago with both genomic and proteomic studies in order to understand the metabolism first of pets and then to translate this to possible mechanism, gastrointestinal mechanism in humans. Our scientific task force at the Airmo Research Center in Milan joined with some pet food industries in order to taste the effectiveness of some functional foods. And among one of the sponsored studies, there is one which involves both academic and clinical veterinarians and human pathologists and oncologists, with the aim to match animals and humans on a common pathophysiological therapeutical basis and to find more effective strategies for human health and disease. This is just to show that we are moving. This is a publication that is going to be published in the next days, and is a review that deals also with this kind of problem, the epidemiologic features of both species. So we retain that a functional food formula should avoid metals and pollutants, should have a well-balanced omega-3 omega-6 ratio, should contain vegetal and fruit extracts, and should contain also probiotics and prebiotics. So the work hypothesis of our investigation was, might these formulas can be used in prevention and treatment of disease in humans and animals? I would say in animals, by now, probably yes. Look at here. This is the first study we conducted, and we had 71 dogs which suffer from dermatitis. This dermatitis was due to probably we strongly retain that this might be related to food allergy. And what we did, we treated these dogs with a nutraceutical approach, which contained a lot of we say functional foods such as herbal extracts and fish proteins instead of meat proteins. As you can see here, I will show you now, here is before the trial and here is after the end of the trial, I mean after 20 days treatment. As you can see, here are the results of the mean intensity index of each symptoms that if you look at time 10, they are almost half. And at the end of the trial, most of them are almost complete, reduced. But what happens on the human side? So, I we are aware that the evidence-based medicine did not show anything that can be proven to be effective. But there are some evidence from folk medicine, such as genetics and blood-purifying properties of some component of our nutraceutical product, such as the Arcticum lappa, and also from Alba silvestris, which also in this case in the folk medicine show an antimicrobial and anti-inflammatory properties, and also what frequently used in skin disorders. And what about Ribes nigrum? Also in this case, the evidence-based medicine doesn't show any proven effectiveness. However, folk medicine shows that there is an anti-inflammatory activity, and this might due to the presence of a particular polysaccharide. And there are also other components that you surely know that are tocopherols, ascorbic acid, and fatty acids, which are known to release some symptoms in atopic dermatitis, fluid skin inflammation. Also to the aloe vera, so everybody knows that there is anti-inflammatory activity, immune modulation, and wound healing, as well as macrophage activation. Also in this case, nothing proved in evidence-based medicine, however, some evidence in folk medicine. But let's see here the second study. Also in this case, we had food-related adverse reaction in dogs, and we are looking at the year before the trial and the year at the end of the trial. This time the trial lasted 30 days. Also in this case, we use fish proteins and natural compounds, and we also added this one, that is Streptococcus salivaris K12. And as you can see in these graphs, there is also in this case an overall reduction of intensity, of mean intensity index of each symptom, and that at the end of the trial is almost completely reduced. Also in this case, let's see what happens in the human side. For in this case, there are, as the professor stated before, there are clinical evidence of the activity of, for instance, Streptococcus salivaris in the reduction of the episodes of acute otitis media. And also zinc supplementation is known to reduce the number of episodes. And let's see the third and last study, where 60 dogs were affected by gastrointestinal disturbs, were treated with, also in this case, with a nutraceutical formula, which contained also Enterococcus faecium and psyllium, as well as other compounds such as Castagna sativa, Rhinum, Pugliare, and Rosacanina. This product is named Forza 10, and Forza 10 is the brand name of the company, of the pet food producing company which supported our studies. And also in this case, I can confirm that all the overall mean intensity symptoms was reduced, was halved at time 10 and almost reduced at almost completely reduced at the time 30. As here are shown also the other symptoms such as polypema, diarrhea, and abdominal pain. And what happens also in this case in human studies? Everybody knows the psyllium properties also in diarrhea, diabetes, high cholesterol, and but also in this case, evidence-based medicine does not show anything of proven effectiveness. However, just folk medicine states that there are viral infection and disorder in kidneys and urinary tracts effectiveness. What about oregano? Oregano also in this case was proven to be effective in the copper-induced LDL oxidation prevention. And also in this case, evidence-based medicine doesn't show any proven effectiveness. resume everything. What are the available functional food? Vegetables, I would say vegetables are principles, whole grains, prebiotics and probiotics, fluids and beverages. I will now focus on the aspect of probiotics and probiotics. One important thing is that we have talked about the effectiveness of functional foods. But what happens if we consider these products in the gut-intestinal flora? So, how the gut microbiota can be influenced by these products and how this can be translated to the human health status. Now, the gut microbiota can be influenced surely by diet, age and race. And there are some in vitro studies, I would say also in vivo studies, such as obese rats, and there is the proven effectiveness of the changes in gut microbiota ecology, so that conventionally raised mice present a 42% or more total fat body mass with respect to those raised with injury-free condition. And also there are evidence, also in vitro, where patients might have an higher prevalence of small intestinal bacterial overgrowth, and this is associated with the expression of 2-like receptor 4 and with the release in the plasma of interleukin 8. So I would say that beyond the direct effect of natural ingredients into the daily food intake, the microbiota can be also influenced by a long-term administration of functional food, both in animal and in human. So, take-home message should be humanization of domestic animals can be a valuable strategy for dietary intervention studies. Also, based on clinical evidence that you have seen, pets might be a very intriguing model of mutual benefit in the functional food area, and chronic food administration might be useful to modify the genetic background and prevent, in many cases, some disease. The possible gaps that we have introduced could be the food palatability, as we said with Dr. before, and also the turnover of the varied menu that is utmost important for human nutrition, especially in child. And the last one is gut microbiota modulation. It has been proven that can be modulated by probiotics and prebiotics, and this may reduce the risk of disease. This is the famous sentence of Hippocrates, that food will be your medicine. So I would like to finish, but just 2 more slides. These are works in progress, and one regards the halitosis management in dogs affected by halitosis by means of a nutraceutical intervention. And this might be very intriguing with human, because there are a lot of components in the mouth of humans that can be related to gastrointestinal disorders and disease. This is just a picture too. And this is the last one that is very, very intriguing. Here, we have only just 3-4 cases. These are dogs affected by keratitis, keratoconjunctivitis sicca, which have been treated for 30 days with the nutraceutical product that I cannot state now because it's under copyright. But as you can see, there is a very promising results if you see the eye before and after treatment. So we think that the nutraceutical approach would be a very alternative, a possible alternative to medicines. Thanks for your attention.
Dr. said also it was an excellent presentation. This presentation is very important, at least for me, because first of all, people who have a dog, cat, so it's you know, when you live with those animals a few years and it's become yeah, so you would like that those animals would live longer, and let's say if the dog living 13, 12 years, imagine if you can create a functional food which is going to be very helpful, and then this dog going to live 20 years. This is one point. And second point is that sometimes it's very difficult when we have some experiments on rats and transfer this evidence to people. So in this case, I believe it can be a little bit safe when you do this in the case of dogs. So that's, and I very appreciate that we have this kind of presentation, even we know a long time ago that yes, functional food can be used for animals, but usually in our conferences we do not have this kind of presentation. So it's really very interesting, and we appreciate it, and we would like in future having this. So please, questions? Okay, if not, so thanks so much, Dr. Cerbo. So everybody understands everything. So let's go to the next presenter, please.